Now the pericardial effusion and cardiac tamponade. Pericardial effusion means accumulation of fluid in pericardial cavity. For the basic recall, we have known that there are two types of the pericardium. One is visceral pericardium and another is parietal pericardium. So the collection of fluid between potential space of the serous and visceral pericardium, that is known as pericardial effusion. And when pericardial effusion is there, when fluid is collected between pericardial sac, then heart will be compressed, and that condition is known as cardiac tamponade. Acute heart failure occur due to compression of the heart by rapid accumulation of effusion or fluid. So clinical features will be heart sound are soft and distant, apex beat is obscured, friction rub is due to pericarditis. Avar's sign are areas of dullness to percussion belong to left lower scapula, and a worsening sign will be cardiac tamponade. Beak stride will be positive, in which there will be distant heart sound, raised JVP, and hypotension. Pulsus paradoxus means decrease in systolic blood pressure by 10 millimeter of mercury during inspiration. That is pulsus paradoxus. So this one is the important in beak triad, means distant heart sound, raised JVP, and hypotension. That is beak triad. It is important. It is positive in cardiac tamponade along with tachypnea, and clear lungs will be there on the X-ray. Diagnosis will be based on ECG and chest X-ray. ECG shows low voltage QRS complex, electrical alternates, which are QRS complex alternate in amplitude due to and motion to and fro motion of the heart. Chest X-ray shows large globular heart. Typical pulmonary veins are not distended. Echocardiography is most useful technique, demonstrates size and presence of effusion and the tamponade. So the management for pericardial effusion are treat the underlying cause, pericarditis, and technique is the site of insertion medial to cardiac apex below the xiphoid process, directed upward toward the left shoulder. In this way, we do pericardiocentesis. So in this way, pericardial effusion or cardiac tamponade can be treated. And the other causes are constructive pericarditis. It is due to progress, thickening, fibrosis, and calcification of pericardium. Constructive pericarditis occurs. In this, rigid pericardium is there, and limited diastolic filling occurs, and increase in systemic venous pressure also occurs. That's why constructive pericarditis develop. Causes of constructive pericarditis are tuberculous pericarditis, hemopericardium, viral, rheumatic arthritis, radiation, uremia, and post-cardiac surgery are the causes of constructive pericarditis, in which constriction of the heart occurs because of fibrosis. Clinical features of this disease are right-sided constructive pericarditis is more common than left-side constructive pericarditis. Patient will feel fatigueness, hepatomegaly, ascites, peripheral edema is there, elevated JVP will be there, Kashmir sign, elevated JVP on inspiration with pulsus paradoxus, and pericardial knock will be there. Diagnosis will be on basis of chest X-ray, ECG, and echo. Chest X-ray shows small heart because of the constriction, pericardial calcification. ECG shows low voltage QRS complex. Echo shows thickened calcified pericardium. So the treatment will be treat the underlying cause, which we mentioned above. Diuretics should be given in order to get out the fluid out of the body. Pericardiectomy is also performed, which is surgical resection of the pericardium, and it leads to dramatic improvement but carries high morbidity. So in this way, pericarditis can be treated.